So we had in the basement of 30 Lyman Street is a music studio, and upstairs there are 2 restaurants. So they were getting cockroaches. So what ended up happening, we found out, is the owner of the building, the landlord, had done a bug bomb in one of the units. So they go scrambling, and they ended up dying in her unit. She didn't have live ones, she had dead ones. Yeah. And she wanted to know where they came from, and then when we found the empty unit, there was hundreds just laying on the floor. So when they get sprayed or bombed, they try and they gasp to get out, and then they die anyways, but you'll find them in hallways. Same thing happens on, you'll see, I think it's 293, 295, and 297 Turnpike Road. They bomb the trash chutes once a week, so trying to kill them before the winter, and same thing happens there.
The rats were concerning. I didn't know we had rats in those. That's like, was it a significant issue?
Which
I'm
location?
sorry, the Ruggles Street?
Ruggles Street, there was a new home being built on Denny Street, and it used to be an old field, and they've known in the past that there's been like little rat holes in the area, so when they dug, they tried to find other places, so they went over right to the backyard of the other gentleman, and he had a fruit garden, and they were, a vegetable garden, and they were eating that. He caught 1 or 2, but hasn't seen many more, so we're just going to watch and see what happens. He's supposed to call me Tuesday or Wednesday, today, or actually tomorrow. Today's Monday, but tomorrow or Wednesday, he's supposed to call me, let me know how things are going with that.
We've had some rat issues in town before, where I think around the center of town and then
Usually
also
around the
down
railroad tracks is where we see them in that area, because they'll travel down the tracks for miles.
We had, Dr. Walsh was referring to, we had a problem on some of those houses near the library. Was that part of town?
That was before I got here. Because after I got here, it was right along the tracks on both sides of the tracks.
And I think that down by Harvey's, they're always worried about the development of rats there.
Oh.
So I think they're on the...
I mean, I've seen big rats.
Exactly.
Yeah.
So it's not unheard of, but we don't typically have like
Huh?
large populations, but they do trap for them and put out things to, trap them. Yeah. Okay, so do we have a motion on?
Motion to approve the sanitarium's report.
All in favor? Aye. The health inspector's report is next. I think we do have violations review on food and kitchen here, although that's probably a separate issue. So. Yeah.
Did the people at the bistro have any response one or the other about the probation status?
I visited them the following day after our last meeting, and they are aware that I will be going out every 3 months. There were no issues when I went, so that's good. And I let them know to send along any reports, so they're getting treatments monthly. So any reports are going to be sent my way. And also I spoke to the owner of the property over there because there was also concerns about holes not only by the bistro but along the surrounding property. So those have been filled, not all of them, so I have reached out and she will be addressing those holes as well.
Sorry, still reviewing, making sure I didn't have any of the notes on here. Good. I didn't have anything else. Do you have anything else?
I do not. The Hunan kitchen, what's the follow plan after
Yeah, actually,
27th?
if you want, we can jump.
We can talk
to
about it now, so it's on its own agenda
Oh, okay.
item, so we can,
Sorry.
we can
That's
talk
right.
about it
Let's do
now.
that before we do the director's
Okay.
issues, if that's okay.
Yeah.
Yep.
Perfect. So I'll give you a little synopsis of what happened. So on October 14th, a call came into the health department regarding Hunan Kitchen at 72 East Main Street. The complainant was concerned about a line of people people outside the business purchasing food. Jen and I got the call and we drove down and witnessed the business was open. There were customers giving money to an employee at the window and leaving with bags of food. We of course were concerned. We spoke to the owner and they gave...
This is because they did not have a permit to be selling food at this point in time.
So that's what we were under the assumption that we had been trying to get in touch with the owner, with anyone. I had gone there multiple times and there was nothing happening there. So we had heard wind of this, underground operation thing happening, but we just never caught them. And so when this call came in, we got in the car and went right over. And lo and behold, once we got permission from the owner to go inside, they did not have a current food permit. There were many unsanitary conditions once we went in. They were closed. They were ordered to close immediately. They were also told to let the customers waiting know that they were closed until further notice. There were many people there, so I think that this has been happening for quite some time. They did put a sign out on the window to inform of the closure, and during the inspection we did notice that the hood sticker was also expired. So we reached out to the fire department. The deputy chief came out while we're still on site. So between myself, Jen, and the deputy chief, we had to explain to the owner, what needs to happen prior to any of this happening. I mean, there was lack of refrigeration, there was anything from, there was food on the ground, there was just
non-food items.
Non-food items. I mean, there was just all sorts of things. So we had given him an order letter to, of what needed to happen. Submit paperwork, pay fees, documentation, all of that. So he submitted, ended up submitting everything. They called me, and on October 27th, I did a re-inspection. Everything had been corrected. The fire department had reached out to us that the hood inspection sticker was all set, the hood had been cleaned. They also had noted during their inspection that the fire extinguishers were also out of date, so those were all taken care of. They had provided pest control reports to us. They are now on a monthly treatment as well, and those reports are being sent to us. So, we just really explained to the owners that, a lot of the perception, they had a door that had a closed sign on it, and then they had this window with a line of people. And so it just was sending out mixed signals, and I said, once you go through all the paperwork and you get the proper permits, you're fine to open. But I think the perception of having this takeout window, that's not really a takeout window, so they said they're eliminating that altogether. So they are going to be a takeout business only. They're going to, use the front door. They're going to start off just weekends only. I think they got the message loud and clear that, not only are we watching them, but the community is also watching them. So I think they learned a valuable lesson. I will probably be going out again just to make sure, but they seem to be doing everything correctly so far.
We witnessed them throw away all the food that was on site, and they were a bit combative during our inspection, just so you are aware. They were not happy.
And when you guys go out there, do you have the, this restaurant has been shut down per order of the Board of Health type of sticker that we can then put on their window, or they just put a note up themselves? Or?
So they actually put up a note themselves. So it just pretty much said, closed until further notice, until I was able to go back and do that reinspection. Once that was done, they're good to go. But most places prefer not to have a sign like that.
No, I'm thinking that for those people that are combative and
Yeah.
don't want you, that's the sort of thing that if you come prepared for something like that and you can be like, yeah, you know what, your sign's not good enough, we're putting up ours.
If you'd like us to do that, we certainly can.
Absolutely.
Not now, I think.
No,
now,
right,
but
in the future.
I think that in the future, when you notice somebody that is operating contrary to how we want them operating, and you have to go out there and basically shut them down when they shouldn't have been open to begin with, it's appropriate to put that up.
My concern is, that's not a way to de-escalate tension.
If you want to have police backup when they're doing that, okay, maybe. But, you're sending them out and you got people who are trying to get, they're taking an educational approach. Look, these are the things you need to do.
I think they were more combative because, there was a lot of food. This was all fresh food. This was all made to order. I mean, you could tell that this is, you know, a very popular place just by the lines of people that were there. So I think their frustration was more, here's this fresh food that now we have to throw away, but we explained to them, you don't have a business, you can't operate, you don't have a permit.
They haven't been inspected.
You haven't been inspected. I mean, you have permits that are expired from the fire department. I mean, there's so many different things.
Yeah,
So regardless if it was fresh food or not, it's got to go in the dumpster.
I do realize that it would not necessarily de-escalate the situation, but if 10 minutes after they leave, they might feel more comfortable just taking down their own sign. They'd feel a lot less comfortable taking down the Board of Health sign that if we went back over some other, you know, the next day or something like that, it's very easy for us to observe that sign. It would be very easy for a potential customer to go over there and be like, oh, there was a problem here, which might still be useful.
Could
I'm
you,
not saying we don't ever do it, I'm just saying,
Right.
Okay.
because
can I ask that you leave it up to my judgment while
Yeah,
on
you can
site?
do that.
Okay,
Yep.
thank you.
I'm sorry, but when you use the word combative, are you mean?
They didn't get physical.
Argumentative,
Yes, very
like
much.
verbally?
Very much.
Okay.
Yes.
Just want to
Um,
clarify the word, just because.
we have more about Run Kitchen, just that you want to say? Okay, so my feeling is that either at this meeting or bring them in next meeting to discuss going on probation. Because there were just too many fundamental aspects of running a restaurant that they seem to be oblivious to.
And I did explain to them, he was very confused on why and what permits he needed, and we tried to explain to him that he's the owner, he's responsible to know what is needed at all times. So that does make sense if you'd like to bring him in front of the board. I'm not sure, I think his wife would be beneficial to bring, so hopefully she'll come,
He's welcome to
but
bring anyone
yeah,
he would like
for
to
sure.
attend.
Can I just, do you remember, you weren't on the board yet, but this is back when Steve was here, and I don't know if it was Terry or Aaron, where the gentleman was running a Chinese food restaurant out of his home, and we had to shut him down, and then he opened up down there. That's the same gentleman.
He burned himself
He burned
during his
himself in his
home.
home, and Steve went in and made him throw away all that stuff. It's the same gentleman, because we said, find a restaurant in town, and that's what he did. And he got that first permit, and he told Maria, oh, I have one. Like, yeah, that's from 2 years ago. You need to get one every year. I think there is some language barrier, but like Jennifer said, his wife would be the one to talk to. I think she kind of understands a little bit more than he does.
And when you went back, someone there is ServSafe certified, or?
Oh, yes, yep.
Okay, so
He
they
did
would-
have them all hung up
Okay, well,
nicely.
that means that someone there would have been aware that a lot
Yes.
of these things were not done properly. Okay.
So I would like him to come before the board.
Yep.
Either, if you say his wife is fluent in English, fine. Otherwise, I think we need to have someone who can translate, okay, so that there's no misunderstandings.
Okay. We will make that work. Next meeting.
So I think that covers both the Hoonian Kitchen closure and the health inspector's report. Do we have a motion to accept the health inspector's report?
So moved.
And a second?
Seconded.
All in favor?
Aye.
Let's see, so director's issues then.
I don't currently have director's issues. It's been a short month. I did work on submit the budget for fiscal year
Jen, do you
2020.
mind putting
Sorry.
the mic a little closer?
I did submit the budget for fiscal year 2023. We are currently working on vaccine programs right now for 5 to 11. And more information will be coming forth tonight and possibly next week.
You expect that to come up by email just for people that might be tuning in? Or how are we posting that information?
So the head school nurse will be giving the link out to all parents. It'll become first come,
So it'll
first.
be coming from the school?
Yes.
Okay,
So-
good.
And how are we trying to get volunteers to help?
So I reached out to MRC, and Nathan thankfully signed up to volunteer from there. But unfortunately, we're only able to get 4 volunteers, and we need a lot more than that to run a clinic. The fire department had other prior engagements, so they weren't unable to at the moment. He is looking forward to doing more in the future. So more will be coming next week, Tuesday, from 4 to 6. They will be holding a clinic with the state, coming in doing 200 vaccines further, 5 to 11. So there'll be vaccines tomorrow available for about 100 children, 5 to 11, with the nurses here.
If we're continuing to have trouble, one option might be to reach out to the medical school.
Okay.
I believe if you have one physician, you can have 10 in attendance. You have 10 up to 10 medical students administering shots.
Oh, good to know. Thank you. That's never been brought up to us. That's great to know.
And what about just town? I mean, have we sent out anything into the town, see if there are local nurses or physicians that want to help?
We would love to do that, but we've been told that's not the best approach. They have to be vetted, and the time frame is just, there's too much to do in order to let that happen, unfortunately.
Would teachers be able to be used without necessarily being vetted specially for that? Or, I mean, assuming they're working with kids anyway.
That would have to get approval from Amber, because they can volunteer to do administrative, but it would definitely have to be something, if they wanted to be paid, they'd have to get approval for
Yeah,
Amber.
no, I was just thinking that for some of them, they may want their students to be vaccinated enough to volunteer.
Oh, yeah,
I-
for sure.
Just one option to reach out if we're really looking for more volunteers.
Yeah, and Amber and I have been in
Talking
contact
already.
about this with Judy as well,
Good.
so we're doing as much as we can at the moment.
Yep.
When you say, who needs to be vetted in order to participate?
The doctors and nurses that volunteer through, we have a color system. I'm not sure if you're familiar with that. It's a
No.
state vaccine program, and they'd have to sign up and go through the protocols to do that.
Okay, so I make a motion that we accept the director's report for October 20th through 11/8.
I
Second?
second it.
All in favor? Aye. See, we are running ahead of.
Just one more question.
Yeah, sure.
Has there been any change with things in Harvey's? Are you still, is Ben Harvey still your point of contact?
Yep.
Yeah.
Everything, I've actually talked to him last week.
Great.
So we have the agenda item of appointing the animal control officer as agent of the board for kennel and animal inspections. Want to have a comment on that?
So typically, it's under the Board of Health. However, that's not something we commonly do. And the animal control officer is, that's what her purview is. So to add her as an agent makes sense.
And do we have to do this every year? Because I believe that we've done this before.
Yes.
You know, and before that, I think we actually there was a period of time where we didn't have a separate animal control officer, and it was Steve when he was director.
Yes, it was actually part of our capital plan, is to have the animal control officer under the Board of Health as an agent to do these inspections.
And right now, who's the animal control officer right now?
What's her name? Sorry.
Melinda McKendrick.
Thank you.
So this would be a motion then to have.
I mean, I'm fine with this. We've done this before, as you said, so I move we appoint the animal control officer, Melinda McKendrick.
Melinda McKendrick.
I'm sorry, was it?
Melinda McKendrick.
Melinda McKendrick, yeah, as an agent of the Board of Health for the purposes of inspecting kennels in town.
Can we leave off the name just in case, you know, she were to change titles or something like that, and then it would still follow the title rather than the person?
Yeah, I'm fine with that if that's okay.
Yep.
Is that fine?
Good.
I second it.
All in favor? Aye. So let's move now into COVID-19 case trends. Amber's not going to be able to make it tonight, and so we have guidance for her, but there could be people that are tuning in, but we can certainly talk about the case trends as that was posted on the agenda before 6:30.
I mean, I'll just at least give you my impression, which is that things are largely stable. There's going to be some up and down elements, you know, in the numbers, and you know, fortunately last week happened to be a down week in terms of the number of cases. But if you look at Massachusetts as a whole and the country as a whole, I think the thing that's notable for what we're in right now is that most of the other spikes tended to be of a bell-shaped curve. It went up and it went down, and then it was low for a while, and went up and it went down. And in this latest one, it went up and it went down like halfway, and it just sort of plateaued. And we're not, the numbers week in and week out really aren't going up, and they're really not going down. Again, Westborough is such a small sample size that, it's easy for the numbers to look a little distorted. But, if you certainly at the regional level, the trend is okay, but it's not like it's continued to drop the way it was, say, a month ago. That's at least my impression of things.
Did anyone see the numbers for Massachusetts today? Because Friday they were very concerning for Massachusetts.
No, unfortunately, I have
Westborough
not
was
looked today.
down, but Massachusetts, it was up 100%. But I haven't.
Again, Massachusetts has some irregularities in their reporting, so I tend to look at like 7-day moving averages.
Yeah, so I've not checked Massachusetts rates today, but the trend that I've been noticing is that Massachusetts does seem like it is going up, but Westborough, on the other hand, I know it's small numbers, but it seemed like the past few weeks it's actually been going down.
Yeah.
Just last week.
I would, again, I view it as basically flat, with some noise.
Some surrounding towns have definitely seen more cases. I think Southborough had a big jump last week. So did we find out an update from Amber on what the plan is?
So her
I'm
draft,
sorry I'm not sure if we were done with this.
To talk a little bit more about just the general case
Okay,
trends.
sure.
I think that what I was expecting was that kind of at this time frame, as it starts to get colder, that we would have actually, if it was going to mirror last year, we would have actually seen an increase in cases. And maybe that's what's happening in Massachusetts. We're not getting that, same sort of spike that I was expecting, a couple weeks ago. I was expecting it not to be flat or dropping, but to have it actually be going up. And so I was pleased to see that at this point in time where the expectation is a huge rise because of the seasonal change, to not be getting that.
So, everything you say, makes sense. I'm not sure it's easy with COVID to predict because you've got so many competing trends. You've got the indoor behavior that you're describing, which would normally lead to a spike, but at the same time, you have increasing percentages of people who either have had the vaccine or getting boosters or have gotten the infection and presumably have some degree of immunity for a period of time. And so, because you have both things sort of competing against each other, that's why for me it's hard to have an expectation of, is it going to get worse, is it going to get better? I really don't know.
Well, in the point where, let's say, that uptick would normally be its highest because of, let's say, the seasonal changes. If the current rate of vaccinations or the current protocols or the current things that people just are normally doing to protect themselves are such that we can hold that flat during the point at which it goes up the most, it would mean that in a month or so when we would normally have expected it to plateau, all of those other things that would be in place actually might lead it to drop even further. So I'm pleased that right now we're not seeing that sharp increase in Westborough.
We are. On Friday
In
in
Westborough.
Massachusetts, I'm not talking about Westborough, I'm talking about Massachusetts. We literally saw on Friday a 100% increase in cases. There were 3,700 cases reported on Friday, and at first I was thinking, they didn't report Thursday because it was a holiday, but they did report Thursday. And so they reported today 5,200 cases, and that's a 2-day number. So that's an average of over 2,500 a day, which is a huge jump. We were seeing like 1,500, 1,600, 1,400 for a really long time. So that is a big jump. So I disagree, and I think I would be concerned that with this colder weather that we are going to start seeing more numbers, even though we had the Friday pretty significantly low number for Westborough. So that concerns me for Massachusetts and how that's going to reflect to Westborough as well. But
Yeah, I mean, it is important to recognize that people don't just spend their entire lives in Westborough. There's a lot of people that live outside Westborough that come into town, and people that live in Westborough and, commute outside of town or travel outside of town. So Westborough is not an isolated bubble, but we do have policies here in place that, hopefully, whether it's just social pressure or other things, seem like it's working right now. And the question is, as we now, I guess, move on to starting to talk about, guidance for the schools, how do we want to interpret the data that we're seeing at the state level and at the local level, and, help give some guidance to the other groups here in town? It sounds like, Melissa, your view is that the guidance should be that masking at schools even after Thanksgiving should be in place. Is that kind of what I'm reading from you, or?
well, yeah, my thoughts on the flexible masking haven't changed from the last meeting. I think it's too soon. I would be very concerned with starting this right before Thanksgiving and during the Thanksgiving.
I think they were thinking the week after Thanksgiving of starting it. I think
Well,
was
they're
the last.
voting on the 17th, which is Thursday, Wednesday. I'm sorry, what's today?
Yeah, I think that's when the vote is, but I think that their implementation date, as far as I was aware, was the
I
week
didn't
after
know what the
Thanksgiving.
implementation date was. I didn't think, from the school committee meeting that I watched, people seemed to think it could potentially happen right after that meeting. So that was a concern. People really were pushing to vote on that and get that happening as soon as possible, right before Thanksgiving, which I think would be a mistake. But
And what about you, Alan? What are your views on what guidance should the Board of Health give to the schools, especially in terms of either change in policy either before Thanksgiving or after Thanksgiving?
For me, it's hard to talk about after Thanksgiving. I mean, you can say in general it might be prudent to be a little more cautious because of the gatherings that take place, but I think in a week or two is going to be much clearer. Are the things that Melissa is pointing to really trends? Are they little blips? I don't know, and it would make a difference in terms of what we should do after Thanksgiving, depending upon what that shows. So
To kind of jump in a little bit and maybe to cut you off, sorry. But if we're all three thinking that the recommendation would be that no change in masking until we have more data, until we see what things are like after Thanksgiving, is that what you're saying, or are you saying something?
Well, my opinion hasn't changed yet from where it was before. I think looking at this data is important, but in terms of is there a significant risk in our schools if kids who've been vaccinated go unmasked? At this point, I would say there's some risk, and I think that has to be offset by what are the potential benefits of being unmasked, which I don't think are negligible. And so, at the moment, given where the numbers are for our town, presumably that's what we're looking at is the spread within our town, I feel that the school committee is in the best position to balance the pros and cons of having students masked or not.
Okay.
If things continue to escalate and got worse, then I might feel differently. But at the moment, based on where the numbers are today, I still feel the school committee is best poised to make those calls.
Okay. Yeah, so it seems like we are pretty much where we were then last meeting, which is there are, a split board in terms of whether we want to proactively give the school any more guidance than what we've given so far. We have several board members that feel the school committee should adopt a conservative approach and keep the masking up until we have more data. And we also have members that feel that the school committee knows some of the nuances a little bit better about, what's going on in the schools and what the risks are, especially of wearing the masks, and so would be better poised to make that decision with the data. But bearing in mind that if things got worse, that we might jump in and say that, no, we really should put masking back in place if it were to be removed. Yeah.
The town, is it just Hopkinton, well, that I know of, their plan, for example, for the holidays was to mask, I think it was 3 to 5 days before Thanksgiving, and then a week after. I know a lot of towns are doing similar things.
Do you know if
Families are concerned not only of their kids getting COVID once they're flexible masking, but bringing COVID, to family members on the holidays. I think that's in a lot of ways more of a concern that people have is the kids, once they're flexible masking in their schools, bringing it home or bringing it to family for holidays. So that would be my concern.
Hopkinton was one of the towns that had applied for the waiver. Do you know if they had actually implemented and is anyone aware of whether cases in that age group has increased since they put in those policies?
I just looked at the town. I don't know the numbers in the schools.
No, I have not heard anything in our circle either.
Maybe you could reach out to
I can.
their health department
Yep.
and see what's what.
Sure,
Because that could be helpful information as we look to kind of,
sure.
maybe put in place something similar to what they're doing.
And I will say Amber's draft masking, flexible masking, for the holidays, after Thanksgiving and Christmas, will be a 5-day masking requirement in the schools.
So after each holiday, it's 5-day masking requirement?
Mhm. So it'll be a total of 11 days that they'll be masked.
Yeah, so if that's what the school committee wants, it doesn't sound like any of us have objections up until the point where we hit that 5-day afterward, in which case then there would be some decision about that. But between now and 5 days after Thanksgiving, if that's what the school committee wants to do, I don't think
I'm
there's
fine
any
with that,
objections.
and I don't mind suggesting that, they have masking, leading up to the Thanksgiving holiday, the half week going into it, and vice versa. That's sensible in my opinion, for the reasons that have been stated.
That's just a draft I'm just want to remind you.
That's included in the draft?
No, the 5-day masking after the holidays in the draft. It's not a final yet.
I think that's a good idea.
Right.
I'm going to go with that.
I think it's actually important that when we have the whole board in agreement on something, even if it is in the draft that the school committee has, but if we're all in agreement that that is a sensible and reasonable thing to do, I think it's good for us to kind of clearly state that so that they are aware of that and don't decide to change the policy at the last minute, without guidance from us if they can. So good, I think that's that agenda item. Is there anything else that we want to talk about in terms of guidance for schools?
I was just wondering if Jen had more information on that before we discuss it, and what their plan is, or from Amber. Did we get an update? We were supposed to get an update on if we knew the student, like they were collecting student data on vaccination numbers that she was going to get back to us on, and then a plan. I had asked about a plan for exposures
So DESE hasn't changed any of their guidelines for exposures.
I'm sorry, say that again?
DESE hasn't changed any of their guidance for exposures, so they'll be staying with the same protocol they have now. As far as vaccine numbers, I don't have updated numbers for you.
Some schools are following DESE, some schools are being more conservative, or towns, I should say, not schools. So you're saying that if there was an exposure of a vaccinated child in a Westborough school, those children can go to school unmasked? That's what we're saying?
I can, we haven't risen to that question yet with this head nurse. I can ask her what she has in place for a protocol. We usually discuss if there's an issue, and that hasn't been brought
Well,
up.
it hasn't been because they're masking. So, it hasn't been much of an issue
Yeah,
in general
I
in
can get
Massachusetts
that.
because schools are masking. But, so the question that I've had all along is, the CDC recommends anyone who's been exposed to COVID, even if vaccinated, go into the community masked for the next 14 days. So if I were exposed to COVID, a COVID case, an actual exposure, I should mask in the community. But in our schools, DESE does not have that. Massachusetts has not recommended that. So there is a discrepancy between CDC and Massachusetts. And so that was my question, if a child who, if kids are unmasked in school and there is a case and there's exposure by definition, how are we guided, what is the guidance to these kids? And from what I'm hearing, I don't know, I haven't heard.
It is always suggested that they do. I'm pretty sure Judy would suggest that, but I will definitely have that conversation with her.
Thank you.
Yeah, so I think that the discrepancy there comes from the fact that some of the policies were put in place before the Delta variant, which was really increasing the number of people that were vaccinated that were getting it. At that point in time, the vaccination was, in the high 90%, protective, and that there just weren't breakthrough cases. And so even if you were exposed, I think they didn't actually even count you as exposed for a little while because you were vaccinated, and even if you were next to somebody that had COVID, you weren't going to get it. Now I do think that the data seems to say that that's, that we should treat even vaccinated people if you were, in a situation where you might have been exposed,
Right, and that's
as potentially at risk in carrying it, and so wearing masks, I think, would make sense in that case for exposure. And so, but the DESE guidelines might be a little bit delayed, I think is what you're saying, that they haven't actually caught up to the fact that Delta has changed this a little bit compared to where things were before.
Well, mask, right. The Department of Public Health and DESE have not changed their guidelines to match the CDC on that, since the CDC changed it, I think, over the summer, which I was a bit surprised by, because I did not realize that Massachusetts hadn't changed that as well. So I wasn't sure what other towns and schools were doing for exposure, since all of the kids have been going to school masked. So that was my
It would be good if you could check with Judy and the school nurse and, figure out how they would prefer to handle it, and if they'd like more guidance from us, then we can bring it up at our next meeting. But
Sure.
Either way, if you want to just kind of bring back what their plan is to us next meeting,
I will.
that would be useful.
What, the approved plan that you're asking? Yeah,
Yep.
I will.
Okay. You all set?
Yes.
Good. Let's see. Do we have anything else on the agenda?
No, we do not.
Very quickly. Okay, well then we've got our December meeting date. Unless we need to meet emergency before that.
The third Tuesday is the 21st.
It's coming close to Christmas.
I think that is the second day of our.
Potential clinic, yeah.
Okay.
So I asked that you are flexible with our meeting, just because of, I'm trying to get clinics in when I can.
Yep.
I think now would be a good time to
Be flexible?
be flexible, and also note that in years past,
I know you say this every year.
we would skip the December meeting. Now, I realize the pandemic last year had an effect on that, and we're still in the pandemic. So perhaps we can make it contingent upon whether there's stuff related to COVID that we need to deal with, or else just go to January.
Yeah, can we do a potential date, and just so we can have it on our calendars, and then make a decision
Yep.
before that if we need it or not?
It would have to be the 20th of that Monday then, as well.
It could be the 14th.
Or, yeah. No, the select board I'm not sure what room would be available at this time, so we'd have to look into that. So, but I'm sure here would be available on that Monday.
Is it possible to do it on Wednesday? I'm seeing patients Monday night.
So that's
20th.
22nd's even closer to Christmas.
Although we could do the 15th or something like that.
So
I can look into that.
you can look into, the 13th would be the Monday, right?
Yeah.
The 20th, the 13th, or the 15th we're looking
Yeah,
at.
so the 13th, I'm not seeing patients. I would have to call in, I'm going to be in California that week, but I could call in.
Okay.
Which
Okay.
time?
those dates look fine to me.
Well, let's do Monday the 13th as a tentative date.
Okay.
If it needs to change, we can change it. If it turns out we don't need to have it, then we can, postpone that meeting. Do we want to put the January meeting on the calendar as well?
I think we should. So that'd be the 18th.
Is that a holiday? I think there's a holiday. Oh, wait.
January the
Oh, I'm
18th?
sorry, is that a Tuesday? Never mind.
Yes.
Yep, so January 18th then would be the next date unless we have the one on December 13th.
That's good.
Okay, do we have a motion for adjournment? Do we have a second?
I second it.
All in favor? Aye. Thank you, everyone. Appreciate it.
Thank you so much.